Holly looks like a normal, well-adjusted 15-year-old high school sophomore. She likes talking to her friends on the phone, riding her bike, watching TV, and spending time with her boyfriend. Holly makes above-average grades and likes math and science classes the best. However, about a year ago, Holly dropped to 72 pounds. She lay in a hospital bed with messy hair, fragile limbs, and a sunken face. Holly was seriously ill. The wicked disease was not AIDS or cancer. Holly has anorexia, a type of eating disorder, a condition which affects many teens and young adults, especially young women. Eating disorders affect 8 to 10 million Americans, 90% of whom are adolescents and children. The average age of onset disease is ages 13 to 17. Early detection and effective treatment are essential in timely and lasting recovery. Primary prevention, however, is even better than early detection in protecting our children and securing their health and well-being. The 3 most common types of eating disorders include anorexia, binge eating, and bulimia. Anorexia is characterized by starvation and excess weight loss. Binge eating is characterized by recurrent binge eating without the regular use of required measures to counter the binge eating. Bulimia is characterized by a cycle of binging and behaviors such as self-induced vomiting designed to undo or compensate for the effects of binge eating. Early signs of eating disorders include unhappiness with physical appearance, depression, irritability, isolation from others, fear of eating in front of others, bringing his or her own food to a group event, complaining of stomach aches before meals, etc. If you notice the warning signs of an eating disorder in a friend or family member, you may be hesitant to say anything out of fear that you're mistaken, or that you'll say the wrong thing, or that you'll push the person away. But although it's definitely difficult to bring up such a delicate subject, don't let these worries keep you from voicing valid concerns. Eating disorders will only get worse without treatment. The physical and emotional damage can be severe. Aside from offering support, the most important thing you can do for a person with an eating disorder is to encourage treatment. The longer an eating disorder remains undiagnosed and untreated, the harder it is for the body and the more difficult to overcome. So urge your loved one to see a doctor right away. The doctor can assess the loved one's symptoms, provide an accurate diagnosis, and screen for medical problems that might be involved. There are many treatment options for eating disorders. To be most effective, treatment for an eating disorder must address both the physical and psychological aspects of the problem. The goal is to treat any medical or nutritional needs, promote a healthy relationship with food, and teach constructive ways to cope with life and its challenges. There are several types of treatment for a person suffering from an eating disorder. The first, psychotherapy, consists of the individual and group therapy that can help them explore the issues underlying the eating disorder, improve self-esteem, and learn healthy ways of responding to stress and emotional pain. A second type of treatment is nutritional counseling. This is when dietitians are involved in the treatment. They can help design meal plans, set dietary goals, and achieve a healthy weight. The final stage of treatment is residential treatment. Residential or hospital-based care may be required when there are several physical and behavioral problems, such as resistance to treatment, medical issues that require doctor supervision, or continuing weight loss. If a person is dangerously malnourished, severely depressed, or suicidal, suffering medical complications, or he or she is getting worse despite the treatment, it may be necessary for hospitalization. Recovering from an eating disorder takes time. There is no quick fixes or medical cures. It is important to have patience and compassion. Provide hope and encouragement, praise each small step, and stay positive through struggles and setbacks. One of the best ways to prevent eating disorders in yourself and others is to adopt healthy attitudes and behaviors about body shape and weight. There are several tips from the National Eating Disorder Association on how to prevent eating disorders. Number 1, get rid of the notation that a particular diet, weight, or body size will automatically lead to happiness and fulfillment. Second, Learn everything you can about all types of eating disorders. Genuine awareness will help you avoid judgmental or mistaken attitudes about food, weight, body shape, and eating disorders. Next, make the choice to challenge the false ideas that thinness and weight loss are great, and that body fat and weight gain are horrible or indicate laziness or worthlessness. Fourth, stop judging others and yourself based on body weight or shape. Turn off the voices in your head that tell you that a person's body weight is an indicator of their character, personality, or value as a person. Fifth, become a critical viewer of the media and its messages about self-esteem and body weight. Don't accept the images that you see that are the ideals that you should try to attain. Finally, choose to value yourself based on your goals, accomplishments, talents, and career. Celebrate your body's unique shape and size and embrace the natural diversity of human bodies.